Spring is here, the temperature is rising, and with it, the threat of Zika, the virus spread by mosquitoes. There is an outbreak now in Brownsville and McAllen, Texas, in the Rio Grande Valley. So far this year, 18 women there have been infected with the virus linked to birth defects. Here's Dr. Jon LaPook.
When we first met 23-year-old Rocio Morado of Brownsville, Texas last month, she was 36 weeks pregnant and doctors were seeing problems with her baby on ultrasound.
We do see some what we call calcifications in the brain.
Morado tested positive for Zika infection. The virus is carried by mosquitoes both in Brownsville and across the border in Mexico, where she visited family early in her pregnancy.
I'm kind of sad, but I know everything is going to be okay.
This is her baby, Hugo.
How are you feeling right now as a new mother?
I feel so happy. I'm so in love with him.
Hugo was born almost 3 weeks ago with a small head characteristic of microcephaly and faces an uncertain future in terms of his development.
For right now, he's doing okay, but maybe like in 3 years, we don't know.
Dr. John Byzantine is Morado's doctor at Driscoll Children's Hospital.
It shows the brain is small, underdeveloped.
Of the 18 pregnant women who tested positive for Zika infection, one other baby, born last month, also has microcephaly. 7 babies appear normal, and 9 pregnancies are ongoing.
I don't know what to tell patients that live here in Brownsville that want to have a family. What do you tell those moms? They're definitely at risk of having babies that potentially could be damaged.
Those people behind me are crossing over from Mexico over there to the United States over here. With so many people going back and forth between Mexico and the U.S. every day, it's hard to know when somebody tests positive for Zika exactly where they picked it up. The virus can be spread both by mosquito bites and sex. With no vaccine available, health officials are focusing on prevention through mosquito control and patient education, because once a pregnant woman is infected, there is no treatment to protect the baby.
In the meantime, we'll keep watching and screening.
Watching and screening and feeling
helpless.
Scott, with warmer weather comes mosquito breeding season, and a big question is whether the virus will now spread more widely to mosquitoes along the Gulf Coast. A vaccine is not expected to be ready until next year at the earliest.
Dr. Jon LaPook on a story we're following. John, thank you.